Well, good afternoon from Terre Haute, Indiana. I am Betsy Frank, and I am a retired professor at Indiana State University with long ties to your university. And your instructors have asked me to talk a little bit about the theory of health promotion. So what is health promotion? It's not just disease prevention, like preventing diabetes, but it is defined as behavior that's motivated by the desire to increase well-being and actualize human potential. It's an approach to overall wellness. And the World Health definition is very similar. It says that it enables people to increase control, that's health promotion, and to improve their health, and it moves beyond your individual behavior towards social and environmental interventions, such as, for example, recycling. Health promotion includes physical and emotional well-being, as well as spiritual and environmental well-being, taking care of our earth. This is a particular theory that's useful, and you can look at it later, but it talks about your patterns of behavior, your personal factors such as biological, psychological, and socioculture, and then you look at the benefits of action, the barriers. Can you engage in the action, like self-efficacy? And how do you feel when you're done doing things? Activity-related effect, and then influences, families, peers, support, and whether it's pleasing to you. That's aesthetics, is an example of situational. All that leads to the plan of action, and then if you have competing demands which you have no control over, then you may not be able to engage in the action. But if you have high preferences, like you really want to do something, you may be able to work it out. So, for example, I need to increase exercise. So I try to go to Zumba. The benefits are that I feel better. The barrier is the class is right around dinner time. Can I do Zumba? On some days, but I do feel better. Now, I have a support group in the class. Everybody wonders where you are. And I know I will look better if I lose a few pounds. So I try to go every week, twice a week if I'm in town. Now, competing demands. If I'm away and out of town, I can't go to class. But my preference is to go to class, so when I'm in town, I have control over that health promoting behavior. Now, the Finnish model looks at broad categories, looks at environment, social networks, the various components of wellness, particularly occupational wellness, and health care. Do I have access to appropriate health care? So how can we view health promotion in order to assist or help persons attain high-level wellness? We know health promotion activities take place at the individual, family, or community level, such as Simonlahti or Lappeenranta City or your workplace. And here are the guidelines, and I would pull them up, but it seems to lock up the PowerPoint presentation. But the guidelines are specific to the European context. Now let's look at a personal wellness assessment, and hopefully we'll be able to get to this without too much trouble. And we are. You can do this on your own. You can look at various aspects of wellness, and then you can make your plans based on Nola Pender's model, how you're going to increase your wellness. So, for instance, in environmental wellness, I report people who intentionally hurt the environment. I recycle my garbage. I reuse plastic bags and tin foil. That's aluminum foil. Different things you can do to have better wellness. Now, when you work with families, think about what would you assess to get a gauge of, we went too fast there. I'm going too fast, sorry. What would you assess about a family's wellness? Well, you might look at their financial status. Do they have enough money to buy food? Do they have an appropriate place to live? Is anybody alcoholic in the family? Those are the kinds of things that you would look at when you're assessing family wellness. For a community assessment, who should develop the assessment? In other words, who should be part of your team? Let's take your university, the Sima University of Applied Sciences. If you were going to do a community assessment of the wellness of the students, who might you include on your team? How would you gather your data? Would you sit perhaps in the area where people eat and make some observations about people's social interactions, their weight, the kind of foods they eat? You could do a survey and send it by email to all the students. And you could hold focus groups. Perhaps you would want to have a group and people could talk about what kind of exercise or food they want on campus so that they could be healthier. Now, a word about healthy work environments. The American Association of Critical Care Nurses has a healthy work environment initiative, and here is an example of what's in that. And you can ask, and although it says nursing in here, it could be other staff. Do you have frequent communication? Do you feel rewarded? Those kinds of things. And that's very important for wellness. Now, when we look at that, the components of healthy work environment, the top components of that assessment are trust, respect, communication, collaboration, and that says safe, and that should be safety. I'm sorry for the misspelling, and I will correct that when I send the slides to Anya. But all these characteristics lead to good outcomes. So, for example, in a hospital, if all the people working together trust and respect one another and communicate the plan of care and work together in the best interests of the patient, and the environment is physically safe, then patient outcomes will be better. Now, here's an example of an article that I found from Finland on occupational wellness. It said that psychosocial factors in the workplace, such as social support, can lead to obesity in males, and in females, lack of job control can be one component that leads to obesity. Of course, there are other factors, such as what you eat and lack of exercise, but these are two particular things in the workplace that you could look at. Do people get along? Do they support one another? Do people have control over their work environment? You wouldn't think that makes a difference, but indeed it does. Now, let's go back to Nola Pender's model that I showed you. How will you analyze the data for your theses or any program planning you do? What are the strengths of the population or group you're working with, and what are their barriers to change? And what actions will you take to build on their strengths, and what actions will you take to overcome barriers? For example, if you are planning some kind of intervention for elderly people in the community, what do these people bring to the community? Well, they have lots of talents. These talents can be used in a variety of ways. They may have, but if you want to increase exercise or get people in a group, a barrier to change might be no place to exercise or lack of transportation. So you will build on their strengths and their desires to contribute to the larger society, perhaps, and then try to find ways to get people together. What kinds of transportation can be provided, for example? Now, what I would like you to do as part of your class, or any way you'd like to do it, use the Pender model and think about programs that you would do in your community. What would you include? It could be for an individual you're working with, a family, or a community. By using theory, or a theoretical framework, it helps you organize your thinking. It helps you in the design process for program planning and then evaluating the effectiveness of your program. Now, I know this has been really quick, but if you have any questions or you want to discuss things, I could do it over Skype, or you could send me an email and we could discuss things one-on-one or via a group. I hope you have a good day and I wish you well in your studies.